Imagine standing in the bustling heart of Thebes over 3,000 years ago. Not far from the towering temples and the murmurs of priests, a different kind of expertise is at work. A medical practitioner, carefully inspecting an array of metal tools laid out beside a patient. The question arises, just how advanced was ancient Egyptian medicine, and could their surgical tools stand the test of time? The reality is remarkable. The Egyptians are often celebrated for their architecture and writing, but their medical knowledge was equally extraordinary for its era. Recovered papyri, such as the Edwin Smith and Ebers papyrus, dating as far back as 1600 BCE, provide detailed instructions for treatments, diagnoses, and even surgical procedures. Egyptian physicians believed that illness was caused both by supernatural forces and by natural causes, such as blockages in the body's channels, a bit like the rivers they depended on. Yet, when it came to treating injuries or performing surgery, their approach was methodical and surprisingly empirical. Excavations of tombs and settlements have revealed metal surgical instruments crafted from copper and bronze. There are forceps for extracting splinters or teeth, curved needles and threads for stitching wounds, scalpels sharp enough for incisions, and probes for examining wounds. Instruments like hooks and cautery tools, used to stop bleeding or remove growths, show a sophistication rarely credited to ancient civilizations. But surgical instruments were only part of the story. Egyptian doctors employed a wide array of medicinal herbs and compounds. Honey was a common ingredient in wound dressings, prized for its antiseptic qualities. Willow, whose bark contains salicin, the active ingredient in modern aspirin, was used to ease pain and inflammation. The careful blending of practical remedies and spiritual incantations characterized their holistic view of healing. Evidence from mummified remains shows healed bones and meticulously set fractures, suggesting that some surgeries, particularly those dealing with trauma, were successful. Brain surgery or trepanation was rare but not unknown, and dental procedures, such as draining abscesses or wiring loose teeth, were practiced as well. Of course, their knowledge had limits. Internal surgery was exceptionally rare, and infection control, while advanced for the time, couldn't match modern standards. Still, considering their resources and the era, the precision and range of their tools was impressive. In the end, ancient Egyptian medicine stood as one of the pinnacles of early medical science. Their surgical tools and treatments laid the foundation for centuries of healing, an enduring testament to a civilization just as innovative in medicine as in the building of pyramids.